What does a visual acuity test tell about myopia? Have you ever wondered what a visual acuity test can reveal about your eyesight, especially if you are concerned about myopia, commonly known as nearsightedness? A visual acuity test is designed to measure how clearly you can see at a distance. During this test, you typically read letters or symbols from a standardized distance, usually 6 meters or 20 feet. When it comes to myopia, the results of a visual acuity test are particularly telling. If you find that you struggle to see distant objects clearly without corrective lenses, this may indicate the presence of myopia. This happens because myopic eyes focus images in front of the retina, making distant objects appear blurry. Specifically, if your uncorrected distance visual acuity is below normal levels, such as worse than 6/12 on the Snellen scale, it could suggest that you have myopia. Research indicates that reduced uncorrected distance visual acuity during adolescence is strongly linked to a higher chance of developing myopia later in life. However, it is important to note that the visual acuity test has its limitations. Some individuals with moderate to severe myopia may still have relatively good uncorrected visual acuity at younger ages, meaning the test might not catch all cases of myopia early on. The severity of myopia can also affect visual performance. High myopia is often associated with more significant reductions in visual acuity and contrast sensitivity, impacting overall visual function beyond just sharpness of vision. Therefore, while a visual acuity test can help assess how myopia affects your vision, it does not provide a complete picture of your visual quality. From a clinical standpoint, visual acuity testing is a fundamental part of eye examinations. It helps detect refractive errors like myopia and can guide further diagnostic procedures, such as refraction tests or retinal evaluations. This testing is also crucial in monitoring changes in vision that could indicate disease progression or complications related to other health issues, such as glaucoma or macular degeneration. In summary, a visual acuity test measures how clearly you see at a distance and can suggest the presence of myopia if your uncorrected vision is reduced. Reduced uncorrected visual acuity in youth is a strong predictor of developing myopia later in life, but normal acuity does not rule it out. The test reflects the functional impact of myopia on vision sharpness but does not assess other visual functions like contrast sensitivity. It is a key part of comprehensive eye exams, guiding further evaluation and management of myopia and other eye conditions. Always consult with a healthcare professional for personalized advice regarding your eye health.